Hello, I'm Raj Owen and I'm the Chief Officer for Community Pharmacy, Leicestershire and Rutland. For the next 10-15 minutes, I'm going to walk you through the and Pharmacy First service. There's been a lot of announcements over the last week or so about the launch of the Pharmacy First service and also the expansion to the other services. And the aim of this presentation is to support you as contractors, as pharmacists and pharmacy teams to decode and decipher a lot of the information that's coming out. So back in May, Rishi announced the delivery plan for recovering access to primary care, and NHS England and Department of Health Social Care published the report. The plan itself includes a huge commitment and pledged £645 million investment into community pharmacies, which we're expecting over the next 2 years. In addition, the plan also set out its ambition to commission community pharmacies to deliver a pharmacy first service. Now, previously, this may have been referred to as a common condition service, but that has been rebranded and the name is Pharmacy First Service. And as part of that commissioning for community pharmacies, it's to support to help deliver Pharmacy First service by enabling the supply of medicines for 7 conditions. In addition, the plan also set out to increase the provision in 2 services, one being the NHS pharmacy contraception service and the second was for the blood pressure check service. And finally, the plan sets out to invest a significant amount to improve the digital infrastructure between community pharmacy and general practice. So what does this mean? What are the announcements this week that we've heard about? So the service launch dates include the 1st of December and the 31st of January, but let's take a closer look. So last week, Community Pharmacy England reached agreement with both NHS England and DHSC on the launch of the National Pharmacy First Advanced Service. As well as that, they also announced changes to pharmacy funding and expansion and relaunch of services as well. So the first one we're going to look at is the pharmacy contraception service. And as part of the announcement this week, Community Pharmacy England have announced that there's be a launch on the expansion of the pharmacy contraception service, and this will take effect from the 1st of December 2023. In addition to that, there'll also be the relaunch of the existing blood pressure check service, and again, that will be in effect from the 1st of December 2023. £75 million per year of additional funding, which sits outside the global sum, has been made available to support the expansion of both these services, and that is a significant amount. And finally, there's also the launch of the Pharmacy First service, which will come into play from the 31st of January 2024. And this is subject to the appropriate digital systems being in place to support these services, and that's really key in this. So let's have a look at what it means for the expansion of the contraception service. So now there will be an introduction of the initiation of contraception in community pharmacies, which is aimed to support a number of women to have easier access and more convenient access to contraception. There'll be the greater use of pharmacy team skill mix, of course, which we hope will encourage contractors to sign up. As part of the expansion of the contraception service, it means that both the ongoing supply of existing contraception, which may have been initiated either in primary care, GP practice, or sexual health clinics, and also the initiation of supply, which will be combined into one service. So contractors or pharmacies cannot choose whether they decide to do the ongoing supply or initiation. That's all been bundled up and it would be combined into one service. The NHS website postcode search will allow patients and enable them to find local pharmacies who deliver the contraception service as well. So it will be in the public domain of whether you're delivering that service or not. The relaunch of blood pressure check service. Well, the existing service was created to help identify patients with the 5.5 million with undiagnosed blood pressure with underlying cardiovascular or heart attack and stroke risks as well. There'll be the greater use of pharmacy team skill mix, and what I mean by that is that the existing service, as today, we know the blood pressure check service can be delivered by technicians and or pharmacists. But under the relaunch of the blood pressure check service, it would mean that any appropriately trained pharmacy team member will be able to conduct the blood pressure element of that service as well. The aim of the relaunch of blood pressure check service is also to encourage contractors or pharmacies that have not signed up to do the service to do that. It's also to encourage contractors who have not completed, who have signed up for the service but not completed any blood pressure checks, but also to encourage pharmacists and contractors to see more patients and actually complete more ABPMs. And that's something that CPE have recognised, that there's been a number of contractors across England, nationally, who have signed up for the service, but there just haven't been enough ABPMs coming out. So if we take a look at the Pharmacy First service itself. So the Pharmacy First service is an advanced service, and it will include 7 new clinical pathways that replace CPCS, the Community Pharmacist Consultation Service. It will be made up of 3 elements, which I'm going to walk you through. The 7 clinical pathways, or the 7 conditions that can be treated through Pharmacy First, are set out in the slide, including uncomplicated UTI, urinary tract infections, shingles, impetigo, sinusitis, infected insect bites, acute otitis media, and sore throat. Now, I've highlighted the 3 in red because for those of you or those contractors or pharmacists that are familiar with the Midlands Extended Care Initiative, Tier 1 and Tier 2, will actually recognise a number of these conditions and see that they're actually overlapping and exactly the same as the existing Extended Care Initiative that runs across Midlands. However, those 3 that are highlighted in red are new to the service and have been brought in. So if we take a look at the 3 elements, so the Pharmacy First includes the clinical pathways, and those are the new elements. So those are the new elements that I've just highlighted. It also includes the urgent repeat medicine supply, and previously was commissioned as CPCS, or what you know as CPCS today. And then the 3rd element is the NHS referrals for minor or low acuity illness, and again, previously commissioned, or what you know as CPCS. One new thing around the Pharmacy First, as we know, DSPs can deliver advanced services or some advanced services, and DSPs can also deliver Pharmacy First. There's the only exception in DSPs which will not, they can do all services, all 7 clinical pathways, but they can only do 6 out of the 7 clinical pathways. And that the remote consultations for 6 of the 7 clinical pathways are permissible, but the one that's not permissible is the otitis media pathway. And the reason for that is that you need an otoscope to deliver that service. So remote consultations for DSPs are permissible for 6 of the 7 clinical pathways, provided that there's a high quality video and if it's clinically appropriate, immediate access to medicines can be facilitated as well, and that's really key. And having heard a number of information or a number of talks from CPE, the high quality video is key in this as well. So what infections can be managed and through what clinical pathways? So that's highlighted in the table beside me, and including the age ranges, so the parameters within the service specification will operate. The service involves providing consultations to give advice and NHS funded treatment via PGDs where appropriate for the 7 common conditions through the clinical pathway consultations as well, which I'm going to go through shortly. So this is an overview, this diagram, an overview of the Pharmacy First service. The consultations, as we know, which are highlighted in blue, mimic that what we know as CPCS. So referrals can come through via NHS 111, GPs, or even urgent care treatment centres as well. And provided that the referral for the low acuity minor illness meets the criteria, that can lead to the patient consultation through the existing CPCS. The one new area with regards to Pharmacy First is that the consultations can now be provided to patients who also self-refer to the pharmacy, for example, what we call walk-ins. Now, the existing referral routes for CPS will apply, of course, to the new clinical pathways, but patients will be able to self-refer for the clinical pathways. That is only allowed subject to the patient passing a clinically established gateway point in the relevant clinical pathway, and I'm going to talk to you a little bit about or describe what those gateway points may look like or will look like. So before I go on to that, I just wanted to give you the assurance in terms of the development of the clinical pathways. These have been developed through multi-professional expert working groups to develop these robust clinical pathways for each of those 7 clinical pathways. And the clinical pathway approach is made up of 4 steps. And I want to make that really clear. It's not just, and particularly for contractors or pharmacists that may have to relay this information to their GP practices, for example, and there may be some nervousness around antibiotics usage or supply through community pharmacies as well. But this really highlights the robustness and hopefully provides reassurance and assurance to those colleagues that may feel nervous around that. So the clinical pathway approach is made up of 4 steps, which includes advice and reassurance, symptom relief, and alternatives to antibiotics prior to any antibiotic being prescribed or supplied. So the idea that these clinical pathways are adherent to a NICE guidelines, and there's clearly a national template for PGDs, which have been developed by SPS as well. Also involved in part of the development of the clinical pathways, the AMR, the antimicrobial resistance Programme Board oversight have also been involved, as well as National Chief Medical Officer, of course, as well as to be expected. So I alluded to the gateway points for clinical pathways, and appreciate you may not be able to see the slide in this, but I will share the slides with you as a link as well, so you can have a look at that in a bit more detail and a bit more closely as well. But consultations will only be considered as clinical pathway consultations if they successfully pass through a gateway point for each respective clinical pathway or each respective clinical condition. So the diagram that you see just above my head is in impetigo. And within that, the gateway point ensures that the patient is suitable for management within one of the 7 clinical pathways, presents relevant symptoms and signs, and does not exhibit any indications of a more serious medical condition. And provided those gateway points have been passed, then it's only then that the patient will then successfully pass through to receive the appropriate actions that are needed. And count for service payments as well. So we talked about in my first slide when I talked about the plan that was announced back in May. There was also some the element around digital interoperability and digital infrastructure. So we're getting a little bit more detail in terms of what that would look like or what that looks like today. So there'll certainly be an update to DOS, Profile Manager, and 111, which is certainly welcome. And referrals from GP to pharmacy will be done digitally as opposed to a paper trail. And again, that's really welcome because clearly there'll be some type of audit trail around that as well. We don't know how that will work, but as soon as we get more information, we'll bring that to you, of course, as well. And there's also been announcements around capability of community pharmacies to access patients' GP record as well. So again, we look forward to seeing a lot more information around that and possibly looking at shared care records as well. So the fee structure for Pharmacy First, I'm going to walk you through very briefly. So there is an initial payment of £2,000 that can be claimed from December up until the service launch of the 31st of January 2024. This service fee will be recovered from contractors who have not delivered 5 clinical pathway consultations passing the gateway point within the relevant pathway by the 31st of March 2024. So that will be recouped if those 5 consultations are not met by contractors. A service fee of £15 per item or for service fee for each pharmacy consultation is in force, and this includes any clinical pathways consultations and any consultations which would previously have been delivered under the CPCS Advanced Service, of course, as well. So consultations delivered from 1st of January 2024 will also attract the £15 fee. And that's really important to understand. And a monthly fixed payment of £1,000 from January 2024 will be awarded to pharmacy contractors delivering Pharmacy First, where they meet the minimum number of monthly clinical pathway consultations. And I'm going to go through my next slide what those minimum numbers look like as well. So funding, we've gone through already, but the fixed monthly payment of £1,000 will be paid to pharmacy owners who meet that minimum activity threshold, and the minimum number of consultations passing the gateway point are described or illustrated in the table in that slide as well. So for example, in February, the minimum number of consultations passing the gateway point is 1. So if a contractor delivers 1, they will be awarded, or even 2, they'll be awarded their £1,000 up, and that increases incrementally up until October to 30. So only consultations under the new clinical pathway element for Pharmacy First count towards eligibility for the initial and ongoing fixed payments. And contractors who don't reach the minimum number of consultations in a month will only be paid the item of service fee of £15 per clinical pathway consultation. So for example, in May 2024, if a contractor doesn't meet the minimum threshold or the minimum number of consultations of 10 and delivers 8, then they will be paid, they won't receive the £1,000 monthly fixed payment. However, they will be paid the service fee of £15 times 8, because they've obviously completed 8 in that month. So next steps, well, this just last night we had details of the service specification and also details of the 7 clinical pathways, including the 23 PGDs and 1 supply protocol. So we look forward to deciphering and decoding that in the next instalment, and also details of registration and setup fee process as well. So we'll be bringing you that shortly. I hope you found this very helpful. Please do get in touch with me, with myself or the team, if you have any questions, and we look forward to hearing from you. Thank you.